Thank you for joining us. As usual, we're going to review NCLEX concepts in a form of questions. One of the first questions sometimes you will see is pediatrics. Piaget, just have to know the stages and the age and what you should expect. That's all. When they give you a question on the patient, it give you the Piaget classification. Know the stages. There's 4 stages: sensory motor, pre-operational, operational, and formal operational. The next thing you do is how do you recognize it? The younger the age, sensory motor, that means 0 to 2 years old. All they interact with the world is what? Mostly sensation. Second, pre-operational, they start to like have ego. They try to pretend like they're playing. They can imitate animals. They can behave like animals. Those are the things. That's how they interact with. Then operationally, they start thinking concretely, right? Concrete, and they can have logical interaction with the rest of the world. Then formal operation, basically, they can think abstractly. So if you know that, the rest is history. When they ask you a question, look at the age, 8 years old. 8 years old fall under what? Concrete, which is like 7 to 11 years old. Therefore, what kind of stage is that? This is an operational stage. That's all. So try to think like that, and you can see that these questions are easy, right? 0 to 2 are sensory. Pre-operational is 2 to 7 years before they go. They start to have like concrete thinking. Then formal operation, like school age group, older patient, and 12 years old and above. So these are the choice is straightforward if you know how to break them down, and that is operational thinking. First one, you can use the same strategy. Now, based on the stages, the Piaget and Erickson stages, you can think about it and say, oh, 10 months old is not developed. So, and the Piaget is in the sensory motor stage. You see what I did? Sensory motor stage. Therefore, what kind of toy would you give to the patient? They interacting with the word using sensation, right? They don't have pre-operational thinking, right? They cannot do pretend pray. And then concrete, they don't have concrete logical thinking. That is operational. And then a formal operational, which is abstract thinking. There's no way you can play a board game if you don't have abstract thinking. Think about it. Based on that, 10 months old is less than a year. The only thing you can give them is something safe they cannot put in their mouth and something that will improve the sensory motor function. So based on what I've explained, this patient, we're going to give them a soft stacking ring, right? Next one, which action by the nurse is appropriate? Is select or apply. A nurse is caring for a client who adhered to what? Kosher. The content, the buzzword. Look at the way I approach it. How do you answer question? Number one, start from the last statement of the question. Is a select or apply. You don't have to pick everything. If you know 2 answers, pick it and move on. If you know only one, pick it and move on. Then what is the problem? Go for the bad. What is the question being asked? Which action then by the nurse is appropriate? That means which action is appropriate. Then you go for the case. A nurse is caring for a client who adhere to what? Kosher. The buzzword is kosher. So I will circle. I'm trying to show you how to answer question. I will circle kosher, adhere to that action the nurse should take, select or apply, and appropriate. And I connect these dots. That's all. And rewrite the question. And next, okay, patient adhere to kosher diet, right? And which action you should take to be appropriate. You have to know the content. The idea is they have certain things that you eat regarding meat and dairy, regarding how you use utensils. Those are, and then the composition. These are the things. Food preparing. How do you prepare their food? How do you serve it? And what is the composition? The first thing is you should separate utensils where served for meat and milk because they don't want to contaminate it. That's the first thing. Separate utensils that were served for meat and milk, because they cannot eat meat and milk product at the same time. So there shouldn't be any contamination. Two, because of that, you want to serve them either in the plate or plastics, something that you can dispense easily because of the separation, and separate the paper. So paper plates or plastics can be used to serve them. And I give you seal metallic. Why do you want to seal it? Think about it. We don't want the utensil to touch the food before you give it to them. So there has to be separation. So these has to be separate. Metallic or paper towels, a paper plate, and everything has to be separate from each other, utensils. So seal metallic utensils is provided so that they cannot be contaminated. Therefore, number 4 is wrong answer, right? If the nurse unwrap the utensils, it's going to be contaminated. And number 5, dairy served without meat. They can eat meat, but they can't drink milk at the same time. You see, separate. So the only wrong answer in the choices is what? Number 4, because the nurse unwrapped these utensils. But this is appropriate, this is appropriate, this is appropriate, this is appropriate. The key is kosher. If you don't know it, I have a good video on religion, on adapting class. You can subscribe to the channel and you can see videos related to that. This is next generation question. You know how to do them. This is to test your knowledge regarding, I said, concepts. You can see I'm taking you everywhere. This is neurology. Do you know your cranial nerves? These are 3 cranial nerves, and they have specific function, right? Cranial nerve 3, right? What is that? Optic. Cranial nerve 9 is glossopharyngeal. Cranial nerve 7 is what? Think about it. It's not 5. 5 is trigeminal. 7 is facial. Each of them have specific function. A nurse is preparing a new graduate about cranial nerves and palsy. Which of the following, when selected, indicate correct understanding of the teaching based on the nerves given? A bunch of words. Rewrite them. Ask yourself, if I see this cranial nerve, what function is associated with it? Cranial nerve 3, right? What do you think? Cranial nerve 7 and 9. So which one is used for eye movement? There's 3, there's 4, and 6. So 3 is one of the involving extraocular eye movement. 9 is not involving eye movement. 7 is a trap. When you are cranial nerve 7, which is Bell palsy, you cannot close your what? Your eyes, but it's the closure, is bringing the eyelid together, but it doesn't involve in eye movement. If you want to look left and right, up and down, your cranial nerve 7 is not involved. So that's a trap. Your reflexes is controlled by cranial nerve 3. Facial expression, that's facial nerve, which is what? That if it's affected, you have Bell palsy. So cranial nerve 7 is that. Swallowing is cranial nerve 9 and 10. I'm giving you content regarding cranial nerve. So glossopharyngeal will be used for swallowing. Monitor after stroke. When you have stroke, there's 2 cranial nerves you should worry about. Swallowing and what? Vagus. Swallowing and speech. Those guys. So this one, cranial nerve 9. I'll explain to you, your eye closure is cranial nerve 7. That's why patients who have Bell palsy, they can close their eyes. So you teach them what? During the day, you wear what? Glasses. During the night, you put patch on so that you don't injure your eyeball. So therefore this. People are equal reactive to light. You testing cranial nerve what? 3. And patch at night if palsy is already explaining it to you. Cranial nerve 7. You can do this on your own. Create a table, a bunch of cranial nerves, and then give the signs and symptoms if they're injured. and you can do what I've done. If you have a question, you can type it. If you're new, this is Adapt NCLEX content mastering for NCLEX. We're doing NCLEX review concepts regarding the NCLEX. The certain things you have to know. These are things you have to know at your fingertips. I'm not saying you're going to get these questions exactly, but at least you know how to handle cranial nerve questions. If you have issue, watch video on cranial nerves and know everything about the 12 nerves and what they're going to ask you is signs and symptoms if he has a problem. So that is the number 4 question. This is also something, if I were you, I will master it. What is that? Select or apply. Don't pick everything. Which of the following need immediate intervention by the charge nurse? That means I got to intervene. What is the problem? A nurse is caring for a client with rheumatoid arthritis or methotrexate who need vaccination. This requires you to think content mastering. If you know the answer, put down the answers. But what am I asking? The buzzword is immediate intervention. Ask yourself, why do I put rheumatoid arthritis, methotrexate? Those are your buzzwords, and I give you vaccine. The question is testing your knowledge on what? What do you think? If you know the answer, type it. What is the question asking you, basically? It's asking you about live vaccine. A rheumatoid arthritis on methotrexate means immunocompromised. Immunocompromised patient should not what? Be given live vaccine. Then the next level of thinking, which vaccine is live? If you don't know it, this question is testing that. Which of these vaccines are live vaccine? Oral polio is a live vaccine. The IM form is not live. MMR vaccine is also live, right? Nasal influenza is also live vaccine. The IM one is not live. DTaP, what do you think? Varicella, what do you think? Yellow fever, what do you think? So which of these are live? Which one are not live? Right? Oral polio is live. MMR vaccine is live. Test-taking strategy, right? Measles, mumps, rubella, therefore varicella, number 5 is also live. Nasal influenza vaccine is also live, right? And then yellow fever is live. The only thing that is not live is DTaP. Therefore, that is diphtheria, tetanus, and pertussis. Those are not live. So this we got to intervene. This, that, and that. This one is safe in this patient. Okay, that is the content there. Who is ready for discharge? Are you safe? Are your problems solved? Are you stable? I don't expect any bad things is going to happen. That's all. You see, that's how I'm going to approach it. Are you safe? Are your problems solved? I don't expect any bad things going to happen if I send you home. ALS with the leg weakness. Think about it. AFib with the INR of 2. Think about it. Asthma patient with the peak flow of 81%. Think about it. COPD with SATs of 90. Think about it. You have heart attack with a new onset S3. Think about it. Who is stable? Who is being fixed? ALS, leg weakness, unexpected finding. Go home. If they have airway issue, that means swallowing, dysarthria, difficulty in breathing, yes, they stay. AFib, your INR is 2. You go home. That is normal. That's what I expect. Asthma, with the peak flow of 81, you are in the green zone. You go home. COPD, SAT of 90 is the best you can get. Go home. MI with new S3, new problem. You stay. Test-taking strategy. You can see, you know the content and you're just looking at it and mastering it. Therefore, 1, 2, 3, 4 goes on. And 4, 5 stay behind. This guy is not safe. Okay, guys. So those are what we got to look at. This is a prioritization. I want to see if you can master what you need to prioritize. What is the priority next action? What would you do if you have to do one thing? A nurse is caring for a client with severe ARDS. That means you have lung problem due to COVID infection, who is undergoing prone positioning for every 8 hours. That means we put their face down so that they can breathe. You remember the COVID time? Yes. What is the priority next action? If you have to do one thing, think about it. Patient has bad lung, is intubated, his face is down. If you have to do one thing, pick your answer, pick your poison. Which one is more dangerous? Checking for their eyes damage, checking for pressure in the face, checking for brachial plexus injury, checking for tube dislodgement. Put your answer down. Let me see if you know what you're thinking about prioritization. This is prioritization. There's one thing you don't want to do for this patient. If it happens, they're dead. And if you want to ensure that, which patient do you think is most important? Yeah, damage to the eyes, or pressure to the face, brachial plexus, or tube dislodgement. Put down your answer. Let me think about it. If you look at it, if you're going to use test taking strategy, 1, 2, 3, saying the same thing is damage to something. But 4 is talking about what? Something that is basically we're giving to support the patient. And if we lose it, they are in trouble. You see how you can answer questions. There's 3 things talking about damage to something. There's 1 talking about what? Tube. If we lose the intubation, patient is dead. Definitely, you can tell you that I know I have to worry about the eyes. I know I have to worry about pressure to the face. I have to worry about the brachial plexus. But if the tube come out, this patient is dead. Therefore, I should worry more about the tube rather than their face. When you're doing prioritization, think like that. Think like that. Which client should the nurse prioritize for a private room? Right? This is infectious control. I know that I pick areas that I think you should master them. Master your infectious control, prioritization, risk reduction, and then maternity will help you, right? Those are the things you have to know. And this is one of them. A nurse is in the emergency department expecting for a patient. Who should you be put in the private room? Ask yourself. You have 3, 4 type of control: standard, airborne, contact, and what? Droplet. Droplets, no, airborne is number 1, followed by what? Droplet, third by contact, then 4 standard. Then you look at each answer choice. Group them into each group. 2 weeks old, he has a varicella infection with a crusted and dry lesion. 2, slap cheek rash on the face and a joint pain. 3, latent tuberculosis infection and a normal chest X-ray. Scabies with the burrows on both hands. If you have to pick one, with your content on infectious control, this is adapting class. If you join us again, adapting class, area of content mastering. Which one would you pick? What do you think? Who would you place in a private room? Who would you place in a private room? Think about it. Who? I'll show you the content if you can figure it out. Varicella is airborne. But what is the problem? It's been 2 weeks. That is the strike. And the lesion are crusted and dry. Dry, crusted lesion is no more infectious. And it's even been more than 2 weeks. After 10 days, you're done. Therefore, it doesn't need isolation. It may be standard. Slap cheek is Pavo B19, right? As soon as you see the rash on the face, they are no more infectious. Once again, if they tell you COVID-19 infection and you see slap cheek rash on the face, no more infection. So this is no more infection. So this becomes standard because there is rash in their face. Latent TB, standard precaution. Therefore, scabies is contact precaution. Number 4 is your right answer. This is a hard one, but it requires you to know the content of infectious control. So 4 is the patient you put in private room. The client presents to the emergency department with acute onset of slurred speech, arm drift, facial drooping, and weakness. This is what we call FAST. This patient has stroke. No two ways about it. Which of the following finding would the nurse recognize as contraindication to the use of Atherplex? A bunch of words. It's a select or apply. Ignore it. Tell yourself, I can pick 1, 2, 3. I don't have to pick all 5. Go for the buzzword. TPA. Who is there contraindicated? That means who should not get TPA if you have stroke fast. There's criteria, right? Uncontrolled hypertension. This is uncontrolled. It's greater than 180 systolic. Therefore, you should not get it. Recent abdominal surgery. 2 months is too long. 2 weeks. If you have surgery within 2 weeks, you're not going to get it. Therefore, this patient is safe. It's been 2 months. Atrial venous malformation. That means your artery and vein are together. They can bleed very often. They can rupture very often. If you give them Atherplex, they will bleed. Contraindication. You have tumor in your brain. You cannot get it. If your stroke happened 5 hours ago, no. It's 3.5 to 4.4 hours, right? It's more than that, out of the range. So this. So which signs indicate contraindication? Number 1, 3, 4, and 5. Please know it. There's no two ways about it. If they give you a stroke question, you should expect Atherplex and contraindication or indication that when do you give it and when not to give it. No matter video you watch, if they mention Atherplex, they don't give you this information, then it's not complete. So know the Atherplex and know when do you give it and when not to give it. Number 10, which medication does the nurse anticipate will be prescribed by the physician? The nurse is caring for a client with bipolar. Okay. Who was giving what? Allopuridol. Allopuridol is for agitation, right? It's giving antipsychotic for agitation. 2 hours later, the client reports what? Restlessness. Bad. I give you what? Allopuridol, you have restlessness and then the urge to move. That means akathisia. This is signs. I give you a antipsychotic and you want to keep on moving around non-stop. We call it akathisia. This is what? And the nurse also observe what? Lip smacking and frequent blinking. So we have akathisia and tardive dyskinesia, right? These are bad problems. These are all extra pyramidal side effect. What is the treatment of EPS? That's all. That's what it's asking you. Paroxetine is SSRI. I can use SSRI to treat what? EPS. Albuterol is for what? Asthma patient. Benztropine is anticholinergic. Propranolol is also used, is a beta blocker. You have to know the content. Extrapyramidal side effect or symptoms is controlled with what? Anxiolytic and anticholinergic. Therefore, benztropine is your right answer. It's an anticholinergic, and that is used to control extrapyramidal side effects. So these are little things you have to know. Propranolol can be used, but it's not perfect. So we're going to give this patient benztropine. I need you to know how to recognize these extrapyramidal because these are high yield questions you should expect. But you got to read the question and figure out what is happening to the patient. Normal levy. A nurse is caring for a client who has been prescribed Ziprasidone. What is that? Second generation antipsychotic. Which of the following statements should the nurse include in the client teaching? You have to come up with your content. What is the content? Second generation antipsychotic. What is Ziprasidone is known for? QT prolongation, QT prolongation, QT prolongation. That's number one. It's also a side effect like any antipsychotic. Weight gain, it can cause sedation, it causes orthostatic hypotension, and it causes fainting spell because of QT prolongation. Now, what teaching will provide? The medication is likely to improve my sex drive, negative, decrease libido, right? I am at risk for mild seizure. It does not cause seizure. I never mentioned seizures. I will take the medication in the evening. I will avoid a gym program. I told you it causes weight gain. Therefore, don't avoid gym program. Based on that, number 3 is the best answer, right? Take the medication in the evening. And then when you take it in the evening, you'll be able to do what? Prevent the fainting spell, passing out, and the other thing. Last question. A client cardiac monitor displayed the reading below. What is the name of this cardiac condition? Look at it. First of all, is this sinus? 1, 2, 3. If I draw a line here like that, there is what? 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Between two R's. 1, 2, 3, 4, 5. So this is sinus. It's a sinus rhythm, right? It's very normal 1, 2, 3, 4, 5. So probably 3/5. So it's like heart rate is 60. So it's not completely bradycardia. It's a sinus. But if you look at the PR interval, always look for the, if you see answer choice, they put block, complete block, look at the P. This is P. This is the R interval. You can see this is too long. From here to here is too long. From here too long is too long. From here is too long. This is what we call first degree heart block because the PR interval is elongated. If you want to learn more, I have a free EKG reading video. You will love it. It has all the one video with all the EKG. And then you watch it, you can see this PR interval is too long. This is a first degree heart block. Thank you for watching. Good luck in your exams. If you like this, just subscribe to the video so that you can get more videos like this. Share it with your friends or join our membership. And if you want a crash course, you can join our upcoming crash course. But good luck, keep studying, and keep charging as usual. Best of luck. Bye.